Hello and welcome to Health Talk with Asif, an unprecedented podcast for doctors and health professionals designed to improve your English for giving presentations at conferences and communicating in the medical field. I am your host, Asif, and today we have a special guest, Hugh Kelly, who will be sharing insights on mental health at work. Welcome, Hugh.
Asif, thank you very much for the warm welcome. Thanks for having me on your podcast, Health Talk with Asif. Very excited about this new venture. And I've listened to the previous podcast and very enjoyable. And more importantly, I learned a lot. So I hope we have a good discussion today.
Okay, thank you. You're most welcome. Can you tell us a bit about yourself and your journey so far?
Yes, I'd be happy to do that. My journey to Azerbaijan has been through many countries and many experiences. I'm an engineer at heart, actually, and I have worked all around the world in North America and particularly in Canada for many years. Worked in the UK, and less than a year ago, I moved to Azerbaijan to work for a Scottish company called John Wood Group, and in Azerbaijan it's Wood Group PSN Azerbaijan LLC. So I work in an office here with about 140 talented individuals in the energy sector, providing services for clients in the region. For their energy security needs and also their energy transition needs.
My first question is, what are some effective strategies for managing stress at work?
No, that's a terrific question. And as I was introducing myself, as I started off as a junior engineer and then project manager and a leader in the business, it's in a technical delivery arena. So I'm not a practitioner, I'm not a clinical practitioner. But I am passionate about looking after our teams, both in safety and environment. But the H in HSE is health, and that is quite often mental health and well-being as well as physical health. So as I've matured and experienced over the years, we see an epidemic proportions of mental health issues within the workplace, and I sometimes see it more maybe within my own industry, within the energy sector. And I'm proud to work for a company that has a strategy for the next 3 years in terms of improving and looking after and having that duty of care for our team members' well-being. So effective strategy starts at the top, Asif, I say. It starts with leadership. I think it needs to be visible leadership, if you would agree, and of course the policies and the procedures and the practices that support the implementation of effective programs for all the people.
Managing stress at work is crucial for maintaining mental health, I think.
Of course it is, yes. Stress and anxiety is just one aspect of mental health as I understand it. You know, there would be clinical issues, maybe depression, that would range from severe, that prohibits your ability to work, but a lot of us and a lot of our team members experience mental health issues that they take to work with them. And because it's not visible, it's not like a broken arm or a bruise, because it's inside, it's not talked about enough and it's not recognized enough. So lots of companies are taking this very serious because of the care that they need to have for their people. Plus, it makes good business sense. We could talk about that.
Okay. And can you discuss the importance of mental health days and how they can be implemented? And mental health days are essential for allowing employees to rest and recover, reducing burnout and increasing productivity.
Yes, yeah, that's right. Mental health days, I think, is a relatively new phenomenon, I believe, in maybe the last 10, 20 years. I could be wrong. And depending on how a company's policy towards mental health days, but they can be invaluable for lots of reasons. The first reason is the person can step back from the stresses and strains of work, and they can recharge and rest, just like you said. But also, just taking a mental health day lets your colleagues know that that's what you're doing. And it raises the ability to talk about mental health in the workplace because, where has Hugh gone? As a leader, I'm taking a mental health day. I'm taking a day where looking after myself, get away from work, get away from my computer, get away from my phone, which can be stress-inducing. Yes. And I'm going to look after myself this day. And if people see others doing this, others will talk about this and do it also. So never mind the actual exercise that would allow someone to recover. It's the visibility and the escalation of that discussion in the workplace. Yes. Yeah, so I think they can be excellent. And you should speak to your employer about what their policy, whether it's paid, whether it's unpaid, whether it's vacation. But when you see the signs of anxiety or stress or poor mental health due to your workplace, separating yourself from that environment can only be a good thing.
And companies can implement this by encouraging open communication about mental health and offering paid days off specifically for mental well-being.
Yes.
I think.
Yes, absolutely. Yeah, if your company has a policy and maybe it's, if you had to go to the doctor because you had a flu, everybody understands, but not everybody understands your ability to take time off for mental health. So, one of the pillars of having an effective strategy is to be inclusive and not to stigmatize someone who is affected by poor mental health. Maybe in that day, or maybe over a long period of time. And having more of those conversations in the workplace can be a powerful thing for people wanting to work there, for people enjoying their work. It works. We spend so much time there that we should bring our best and bring our true self to work.
Okay, thank you. Thank you for useful information. And my next question is, how does mental health impact productivity and overall job performance? And as we know, mental health directly affects productivity and job performance.
Yes, yeah. I agree, Asif, it does. Maybe 20 years ago, we didn't know the answer to that question because we weren't talking about it and we weren't quantifying. As a project manager, we improve by measuring and then making improvements against data. Data can be very powerful. And we have data now on productivity due to mental health issues. We have surveys on a local and a national scale. And we know that this is a major crisis within the workplace. And we're now talking about it in Azerbaijan also. And other countries are more advanced than the UK and Azerbaijan, and other countries have so far to come. So there's still so much to be done. But we know that if your mind is distracted, or you're burned out, or you're suffering or living with mental illness, you cannot bring your best to work. You either need to recover, and what we find when you don't take time out, you don't do your best work. And in our environment, I worked in the energy sector. It's a very hazardous environment for our crews, and a lot of men and women work in operated assets, confined spaces, in a high-pressure environment. And can you imagine if they aren't effective in their work due to mental health issues, then as well as their own personal well-being, they could bring the safety of those around them into some jeopardy. So there is a serious safety issue associated with it, as well as the productivity issue of the person themselves.
What are some misconceptions about mental health at work? And one common misconception is that mental health issues are a sign of weakness, and which isn't true.
Yes.
And another is that seeking help might harm one's career. But in reality, addressing mental health issues can lead to better performance and job satisfaction.
Yes. Yeah, I agree. I see. There's so much in that question. What I would like to say in terms of misconception is the stigma associated with mental health in the workplace, or maybe in life in general, that has certainly been there in the past, and more industries are becoming more aware and more informed, and the stigma is generally lifting in some environments, but not everywhere. So because of quite often the non-visual nature of poor mental health, you may see it in someone's expression or in the carry, but that's no guarantee. Someone could be the happiest person on the outside, but yet suffering on the inside. I'd like to take a little segue here because it's such a serious issue. There are people who take their own lives that we don't talk about, right? There are signs of suicide. Young men in particular these days, the sense of hopelessness, and if we could make it less stigmatized, then these young men in particular would talk. They would talk about what's on their mind and what is clouding their judgment and what is affecting their lives. But we, as older men, we don't allow the younger men to talk that way because we think it's a sign of weakness, because that's what our fathers told us. I'm sorry if I keep talking about the male agenda or the male side of things, but I feel passionate about that. As an engineer, a male engineer in that environment, I have experienced it, and I see it, right? I see you're a product of your mentors and your lineage. And then what you said was a very, very good point. Is the if you think you speak up, sometimes you think that's my career over. If I say to my boss, I'm quite anxious, I'm too anxious to speak at this meeting, or I suffer, I live with depression. Boss, you need to know that. And the boss wants, I want a party goer and an extrovert. And then you lose your job, or through misunderstanding, you're lazy because you act in such a way. So people will stop talking about it, and it becomes a self-fulfilling spiral, which could have tragic consequences for the individual, and certainly doesn't lead to an inclusive, wholesome work environment. It leads to an environment where issues are suppressed and people don't talk about them for fear of reprisal. So I think, as a leader in the industry and where I work and where I can influence it, much like safety, if you want someone, like in safety, we have established mechanisms now when somebody can speak up when there's a safety issue. I think we are almost there without losing your job, without getting in trouble. But mental health, we've still got a long way to go. Men and women don't feel they can speak up about the impact of their poor mental health on their work and on their lives for fear of ridicule or losing their job. So you make some good points on that in terms of misconceptions. And I think with the policies I've talked about, but mostly examples, like leadership examples and leaders talking about their experiences, can really start to impact, let me say, the next generation, right? Most of my workplace here in Azerbaijan are millennials and maybe some Gen Z, and these young people demand a work-life balance. They're not, maybe like you or I are not, I'm going to turn up for work, do 40 hours and work hard. They work hard, of course, but they want their workplace to be somewhere where they can be welcome and they can be included. Yes. Why not? You spend half your life there, right? A third of your life, maybe. So in the workplace, so it needs to be somewhere where you have value. And I think it has value when you can be authentic. And the misconception with mental health, it can be suppressed, and it can turn toxic. And in the worst case, as I said, if we don't look out for one another, people will leave the workplace. Great people with great things to offer. If we don't sort out toxic line management, if we don't sort out oppressive work systems and the expectation of work and no play, then people will leave, and great people will leave. They will seek better workplaces. So it's good business to be able to address this in the workplace. One, I'm repeating myself a little bit, one, to be authentic, but also one, to retain the best people so that you have a whole experience at work. Like my son, he wants more than just turn up in the morning and leave in the afternoon. He wants to meet people. He wants to socialize. He wants to have fun. Yeah, and that's okay in the workplace. It's a modern outlook that's proven to be beneficial. You work, you get the work done, but you also enjoy being there.
Yes.
If at all possible. Not everybody has that luxury to enjoy their work. Sometimes it's out of necessity, but good times are there, and it can be a powerful motivator if you feel that you're working within a supportive environment.
Yes. Okay, and what advice would you give to someone who feels overwhelmed by their work environment? For example, if you're feeling overwhelmed, I think it's important to reach out for support, whether from colleagues, supervisors, or mental health professionals. And I think prioritizing tasks, setting realistic goals, and taking regular breaks can also help manage overwhelming feelings.
Yes. Yeah. That's a good question, Asif. And those practices are absolutely, like speaking to line management, for sure. Speaking to your supervisor. But we've just spoken, there's still a little bit of stigma, and depending on the reception of your line management, you might not feel you can go there. Maybe your line manager is not compassionate, not informed. So I think it's important to have a series of options. It's not one solution. It's a series of options. Like the minimum duty of care that we have towards our people is to be able to speak to anonymous sources at maybe in an employee assistance program. Like pick up the phone, they don't know you, you're anonymous, and maybe you could discuss, and that could lead to a solution. It really could, but sometimes it's hard to make that call, but it's anonymous. In our workplace, several years ago, and now I think there are certainly hundreds, maybe thousands, of mental health champions in the workplace, right? So not medical professionals, like I said, but not even leaders, just people in the business who are trained in the basics of the symptoms, the impact, the tools. It's like a toolbox, right?
Yes.
So and the main thing that these people they have to be approachable, right? So no point in having a mental health champion who's grumpy and snarls and won't talk to you. So someone, a senior leader or a graduate who just came through the door, they can be trained as a mental health champion. And then you don't have to go speak to your boss, possibly. You go speak to this mental health champion. You say, can I have 5 minutes? And they want to tell you something. And then they might say, they might just listen, which is sometimes all people want. Listen to what's going through, right? Because once you articulate it and speak it, the problem sometimes is not as big as in your head if you can speak, right?
Yes.
And as men, we could learn from that. But this person then might say, okay, having heard what you said, did you know there's an employee assistance program? Did you know that there's this website? Did you know there's this toolkit where you can do a little stress check? Did you know that doctors provide this service? Did you know that we have a counsellor on hand? You know, and the person may not know any of that, but the mental health champions can say, signpost and say, you should go over here. This is where you should go, right? And of course, if it's even more serious, if someone is, I'm sorry to bring it up again, but if someone is thinking of doing something serious to themselves, you know, you have an amazing opportunity and obligation to intervene, right? And to turn that around. So I spoke a lot about how to deal with the overwhelming work environment by going to get advice and going to get help. That was maybe a wrong answer for me, or at least it's only part answer, because the first answer, Asif, is possibly to adapt your working environment. Maybe that's why you would speak to your line manager and say, I'm overwhelmed, there's too much work.
Yes.
I'm doing too many hours. I am missing my lunch. I'm not getting home. I've been doing this for months. And I know how in certain work environments there is a pressure to do that, to be seen to be working, and also deadline driven. And sometimes our workplaces are shrunk, that more people or less people have to do more.
And yes, there must be some incentives, yes, for workers to enjoy their work.
Yes. My advice there, before somebody leaves the workplace, because you can only do work in that environment for so long before you say, I got to get out of here. I've got to leave, or you become disengaged because of the oppressive nature. So I think good line managers, good supervisors, good colleagues might observe that this is not sustainable for the team member, and we need to change the work environment. We need, and we spoke just before the podcast started on boundaries.
Yes.
You know,
yes, that's correct.
Yeah, allowing our people to set boundaries, right? We set, and we're talking about mental health at work, so I'll talk at work. You're quite often paid to come to work, and you're paid to leave work. You have no obligation outside of work to do anything else, right? So switch off that work phone when you go home. You know, our boundaries, right? The email you get from your boss.
Also, it helps us mental health, because being not disturbed after work hours, I think it affects the mental health.
I think so. Yes. And I speak hypocritically, of course, because I told you about our company. It's been going for a long, long time. It's an international company. We work in 64 countries, right? We have 34,000 people around the world. When we're thinking about going home, our colleagues in Houston are waking up and they want to talk to you, right? Before
depends on the time.
Before we get started in the morning, our colleagues in Melbourne, Australia, want to do something before we even get out of bed, and that's exciting, and it means we can deliver to our clients because we have a global community, a workforce. But if we don't set some boundaries, we'll work from 4 o'clock in the morning till 12 o'clock at night if we don't set some boundaries. So, and I think we ourselves have an obligation to do that. And when I think about it as a leader, I probably have an obligation not to demonstrate poor behaviors to my team. I should establish my boundaries so that my team say, he gets it. Okay, we all work hard, and sometimes we have to go that extra shift. But over and over and over again, it will lead to burnout, as you had mentioned.
Yes.
And I think we have to establish those boundaries and maybe be accountable either to our partners or to our colleagues, just to take care of ourselves. Because see, how can we take care of anyone else if we're not taking care of ourselves? I think.
Yes, of course.
Yeah, it's a great
That's
question.
the point, and it's absolutely true. How does job satisfaction relate to mental health?
They're intrinsically linked, I would suggest, Asif. You know, quite often we accept employment because it's an area we want to work in, or it's beside, or it's convenient to get to a workplace, or because we need the money, we need to be paid. But we don't do our best work because of all of those factors. We do our best work when we are satisfied in our job place. Right? We talked earlier in some of your questions about being authentic in the workplace, and I think that's where we could do our best work. And it's where we're satisfied in the workplace. And one thing that holds us back from doing our best work can be, for whatever reason, poor mental health and low well-being in the workplace environment. So we know, and we've discussed, and there's lots of research out there now that this is something that we have an obligation to look out for ourselves and our peers and our teams to lift them up in that regard. So, like job satisfaction, as we mentioned, we've been there so many times. But like, if you're impacted by stress, might be relationships, could be finance, might not even be work related, right? It could be gambling, it could be addiction, it could be your relationships are in a bad way. It could be that you're had a significant loss in your life, a parent, a child, a pet. These are things that decrease, of course, naturally and unnaturally our ability to function, and that's okay on a temporary basis to be sad and to have. Yes. But some addictions don't go away without intervention, and the symptoms of this would be sometimes your body tells you that things are not right. Sometimes your gut, my gut, says things are not right. And sometimes your mind tells you that things aren't right. And how can you have satisfaction in work without dealing with that? Well, like one thing we haven't touched on, Asif, and I wonder if we would be sleep. Right? You could have a whole podcast on sleep. They're like the chronic lack of rest time in the medical profession. Doctors who work 16, 18 hours a week. That's crazy. Yes. These people need to have the most sleep because they're surgeons and doctors and physicians and nurses. So, and we see this in our environment also. And sometimes the demands of the work stop you from sleeping, and sometimes the nature of the work stops you from sleeping, or what's on your mind. So you have to listen to your body. If you're thinking about work, and then you can't sleep, and then you have to get up in the morning and it's a chore to get to work, you have to fix something. You have to talk about it. And then you have to fix something, because you will never do your best work and you might never recover. But these indicators, such as lack of sleep, maybe your appetite, maybe your I call it your gut instinct, but also your body saying you're not happy. You should listen and seek to fix that where you can, or have that fixed through the mechanisms that we spoke about earlier on, in terms of anonymous programs or friends or mental health champions, checklists, and good leadership within the work environment. So they are intrinsically linked, job satisfaction and well-being. Of course they are. And if you can get this right with your entire team, you can do amazing things if everyone's on the same page, and allowing people to heal at their pace. Like some people, yes, you can find a problem, fixed. We'll reduce your hours, fixed, right? And things improve. Other people will take months or years.
Yes, of course.
And you have to allow them to improve on their terms.
And what impact do long working hours have on mental health?
Yeah.
I think we mentioned is
We mentioned it, but absolutely. We've mentioned just there now in doctors and in my sector and in the service industry. Oh, so many of us are putting in so many hours either to make enough finances in this cost of living crisis that we're in, right? There are bills to be paid. So there's motivations to do that. And it's chronic, Asif. I think I see it, I've heard in Azerbaijan and around the world. Long hours as well has been seen maybe a macho thing to do in some environments. It's necessary to pay the bills. But you could be paying a higher price yourself, I think, for those long hours. Now, let me just expand on the question or the answer a little bit as I see it also. One of the worst things can happen is you could do long hours but not be present.
yes.
Right? You get out of bed, you have some breakfast, you go to a workplace,
Yes, that's correct.
and you don't do any work.
You're not in the present.
No, you're absent,
Yeah.
but you're there, but you're absent. And I think that's part of a problem. I've got all these hours, but I'm not bringing myself to work. So, as we there's so many things feed into that. See, I've mentioned the cost of living. We're just coming out of a pandemic. There are wars and conflicts around the world. There is so much happening, and we have so much responsibilities, to contribute to the workforce that it should be enjoyable. We should bring our best self, and we should, because we spend so long there. But the imbalance would be that we spend all our time there and we're not present. There's no social engagement.
That's the point. Is absolutely true.
And if I could, well, maybe it's getting into the occupational health side. A lot of our jobs in my industry are very sedentary, and since COVID now, a lot of our communication is on a TV screen. Maybe like some of your viewers are looking at this on YouTube. Not so long ago, if you wanted information, you would move from where you were sitting and you would go get that information and maybe meet some people on the way and maybe speak about how your day has gone. A lot of that has been removed from us because now if we want to talk to someone, it's on an agenda based on a virtual meeting, and we lose that social interaction, which as humans we crave. Right? Sometimes we think we don't. I know sometimes we'd rather be left alone, but essentially, I think, not being a sociologist, we crave interaction, right? I'm enjoying this conversation with you. If we did this on Teams, we could get it done, but this is much better, right? We're communicating much better, I feel.
Yes, of course. Thank you for your comprehensive answer. And my last question is, can you share a personal experience that has significantly influenced your perspective on mental health in the workplace?
Yes, Asif. No, thank you for that question and I guess the opportunity. It's interesting that you asked that question because our personal journeys and sharing those personal experiences often resonate with other people. So if leaders in the business or anyone in the business can share their stories, then we can relate to those stories and say, I've been there. Maybe I can help you or you can help me.
Yes.
So although we talked earlier about stigma and keeping it quiet, but as a leader, I have to answer your question. I have to share that story, right? If I have a story, of course. And I do. I mean, it's hard. I've been working for 30 years in this industry and 20 years with this company, and it's a great company. And I do recall an experience several years ago where I saw an opportunity, and I was offered an opportunity within the business to go in a different direction and a new frontier of our company's strategic view. I said, here's an opportunity for me to get on that train and learn something new and help the company achieve its strategic ambitions. So I did that full of enthusiasm and went very well. There were some warning signs that maybe I should not have made that move because certain behaviors within that particular area of the company. But I was determined to do well, as I have done well in the past in terms of learning new things and leading new teams. So I'll try and make a long story shorter. Through various circumstances, I found myself reporting to an executive position within the company, and at an executive level, these people, these leaders can be awesome people, but they're also under a lot of pressure themselves. Right? They've got the company in their hands, right, and the direction. So you can't mess about. You have to be on point. And I was in this new sector, although I was like a competent professional. And the particular behaviors, particularly if I sought to challenge a senior leader, that this particular leader would be very intelligent, of course, to reach that level, very hardworking themselves. But there was an element of toxicity in that team, and an element of like abuse, mental abuse almost, psychological abuse. It wasn't a psychologically safe environment. I could not put up my hand and say, this is not right, this is going wrong. And in fact, I did have significant concerns on a particular aspect of investment. And so I raised that concern and ridiculed. You don't know enough about this part of the business. Who are you to say this? And even though I've been working for 25 years, my confidence drained away. I thought maybe I'm no good. And this went on for months because that's generally how it goes. And remember I spoke earlier, and my body was saying you're not happy. My family were noticing I wasn't happy. I wasn't sleeping. I was consumed. And what I tried to do was work my way out of this problem. But work wasn't the problem. I wasn't work harder. So I became clouded in my judgment. I recall I made mistakes. I lost confidence, and I thought of resigning. I've been working for, at that time, 15, 16 years. I thought I've got to resign because I'm no good here. I thought I was done, and here's what I did, Keith, that changed it. And people close to me had advised it, of course, several times. Is you need to speak to a doctor. You need to pick up the phone and go speak to the doctor, not about your busted Achilles, not about your strained shoulder. You want to speak to the doctor about your mental health. And I thought, I can't do that. I'm a senior leader. I can't So I thought I was done. I thought maybe that's weakness. Of course I thought it was my fault. That's how it was. And I spoke to a wonderful doctor, and I learned three things, three strategies. These are very personal to me, and I don't know. I'm sure they're not in a book. But good friends helped me through this, right? Helped me overcome the particular place that I was in, as well as the doctor's attention. But you must remove yourself from that environment. You must remove yourself for a day, mental health day, for a week, how long it takes, because you can't make good decisions in that moment. So in my personal journey, I was making bad decisions. I was in tears. The last thing I wanted to do was turn on the computer at the beginning of the day. It was during the pandemic also. It was during COVID. So the first bit of advice is get yourself out of that environment. Now, take a holiday. Take unpaid holiday. Take sick holiday. Speak to a doctor and get signed off work if you must. But you must remove yourself to allow that fog to lift. It was one thing. The second thing would be surround yourself with people who care about you. As a person, right? Don't surround yourself with these people who don't care about you.
Yes.
Right?
That's the main point, yes.
If it's your wife, if it's your children, if it's your best friend, if it's your dog, surround yourself with people who care about you. They care more about your health, and they care more about your well-being than they do about your job.
Yes.
That was a great thing. And then the third thing, which is simple too, is don't stay inside even, get outside. Get exercise. Keep your mind and body moving. This was incredibly powerful for me because for that whole time, I didn't want to exercise. I didn't want to walk. I didn't want to go outside. I just wanted to work and try to sleep. So those three things, in terms of separating yourself from the stimulus that's hurting you, surrounding yourself with great people, because there are great people out there in the workplace or not, and get outside and get active. Were things that helped me get through that period. And one thing you and I spoke about earlier, even leading up to that point, I had some training and I wanted to help my team, and I wanted to understand well-being in the workplace and see if I could support my team. And I was okay at that. I generally approachable. But in that moment, I couldn't help anybody. In that moment for months, I couldn't speak to someone and help them because I was in such a dark place myself. So it speaks to looking after yourself before you can help others, right? And then the second point, because it worked out, I got that help and things changed within that department and I moved from it, and that department no longer exists in our business because of the nature of it, for one reason. Asif, I think I'm just a little bit better equipped to spot those signals in my coworkers and to help them because I've been there in that workplace. I would never wish it upon myself or you, but having been there and when the workplace issues were resolved, my mental health improved, then I'm able to help my colleague who I see, I was like that a few years ago. And here's surround yourself with good people, remove, whatever fix or whatever support I could give, I think I can give it better because I've been there. And there's no substitute for experience, in terms of giving advice, right? Which is why your question is so important about, sharing your personal journey. Maybe what I've said about my personal journey, maybe there's one person on YouTube or or however this is broadcast who might say, yeah, that helps them. And they won't know that story until you articulate it and speak about it. So I hope that was I didn't rehearse that answer, but I'm glad you asked about my personal experience, and I'm happy to share it with you.
Thank you for accepting my invitation to participate on my podcast, and I'm very pleased to have you as a guest on my podcast.
Asif, and I'm very pleased to be here. Thank you for the invitation once again. Best of luck with Health Talk with Asif. I've enjoyed the previous podcast, and I will subscribe to what's happening going forward. Thank you for letting me share my limited experiences on this very, very important topic. Well done.
You're most welcome, Hugh. That wraps up today's episode of Health Talk with Asif. Thank you for listening, and special thanks to Hugh for sharing his insights on mental health at work. If you enjoyed this episode, please subscribe, rate, and review our podcast. Be sure to follow us on Instagram, Facebook, YouTube, and TikTok. Just remember, the more we learn and care for our health, the more we enhance our well-being and professional practice. Until next time, stay healthy and keep learning.